Yes.
I'm going to go ahead and get started, okay? I have 2 minutes after.
Sure.
All right. Well, welcome everyone to the Statewide Children's Committee. I'm glad so many of you are on the call. Thank you for being able to take time out of your day to join this. I know we have wonderful presentations that are coming up. Just some housekeeping I'd like to go over. This meeting is being recorded per Governor Lee's Executive Order 51. So we will be recording, typically we record audio only, but since we have presentations on here, we'll be recording video too. So if you do not want to have your face on video recorded, I would go ahead and disable the video feature on your end of the computer. If you don't mind though, then that's fine. Also, please mute your phone or your computer if you aren't presenting or speaking. We get so much feedback on our end if we're not all muted. Please wait till the end of presentations for any questions. If you want to utilize the chat box feature for a question, if you've logged in via WebEx, that's great, and I could read that question for you. Or if you just want to speak up at the end of a presentation, you can do so then as well. I think that's all I have on my end. Lindsay, I'm going to hand it over to you. Lindsay Blevins, our new Vice Chair for the Statewide Children's Committee. She'll be leading this call until Ricky Harris can join us in a couple minutes.
Thank you, Kirby. Good morning, everybody. It looks like from the chat, there's a few people who are having some issues with their audio. That went ahead and called in so they can hear. So we've got a couple people who maybe can't hear yet who are going to be joining us momentarily, but we do have a good group on, so thank you all for joining us this morning. Like Kirby said, I am the new Vice Chair for the Children's Committee, so I'm grateful to be here today. I missed the last meeting. So we're going to start with some introductions, and then we're going to get into some presentations so we can be cognizant of everybody's time and wrap up by 10 o'clock. So I'm going to go ahead and I'll start. Like Kirby said, I'm Lindsay Blevins. I'm the Vice Chair. I am from Region 7 in Memphis, and I am the Children's Committee Chair for this region as well. I work at Lakeside, and I'm a licensed counselor over here. So we are going to go through each region and have everybody introduce themselves by region, so name and region. So we'll start with Region 1. Is there anybody from Region 1 on the call? Can you all hear me? Hello?
Yes, we can hear you. There just might not be anybody from Region 1.
Good. It was like super silent, and I was like, wait, did I lose everybody? Okay, yes. Is there anybody from Region 2?
Yes, Wayne King, council member.
Mary Katsikas with Helen Ross McNabb.
Thank you. Region 3?
Sorry, Angela Webster with the Association of Infant Mental Health.
Hi, Amy Irvin with Omni Community Health.
Thank you. Region 4?
Javine Johnson with the Children's Committee.
Thank you. Region 5?
This is Alicia Smith-Knight from TAMHO. I live in Region 5, but TAMHO is statewide.
Thank you. Region 6?
Hey, excuse me. This is Steve Petty. I'm Region 4 or 5, whoever just needs a representative. And also a council member.
Okay. Region 6?
Sherry Moore with Tennessee Commission on Children and Youth.
All right. Is there anybody from Region 7? I'll do myself. Okay. All right, I'm going to go ahead and have our presenters introduce themselves. So we have Elizabeth from Juvenile Justice Reform, Local Diversion Grants. Do you want to introduce yourself?
Yeah, hey, good morning. This is Elizabeth Suddy-Reed with the department. Good morning.
Good morning. And then we've got several people from Family First Prevention Services Act. Do y'all want to introduce yourself?
Hi, yeah, I'm Helen Rogers. I'm with the Department of Children's Services and am on the Family First implementation team with Rebecca Bevins and Michelle Ryder.
Hey, this is Rebecca Bevins. I work at the Department of Children's Services in the Office of Child Safety.
Hi, I'm Michelle Ryder. I work at the Department of Children's Services in the Office of Child Programs.
And is Carrie on the line?
Yes, I am. I am here.
Hello, Carrie. Thank you for joining us.
Hello.
All right, and then who from the department is on?
Well, this is Carrie again. I'm from the department. So I am the director of the Office of Children, Young Adults, and Families.
Thank you.
Ava Easley with the department, Director of Planning.
Kirby Fye with the department.
Hey, this
Amy
is Jessica
Hollins
Mullen
with the
with the department. Oh.
There's somebody
Amy Hollins with the department.
So I heard Amy.
Jessica Mullins.
Kurt Hipple.
Katie Davis with the department.
Benita Hayes with the department.
Melissa Binkley with the department.
Ashley Jasinski with the department.
Okay, is there anyone else as we were going through that missed introduction?
Megan Gaylord with Youth Villages.
Lisa Pellegrin with Department of Children's Services.
Anybody else?
Lindsay, I see Melissa McGee. I don't know if she was able to call in. Melissa, are you on the phone? I just want to make sure that you get marked for attendance. She was on previously. There she is.
All right. Perfect. If we miss anybody else, put it in the chat, please. So we are right on time. We're going to get started with our first presentation, and I don't know, it looks like it's already up here on the screen. So we'll let Elizabeth take it away, talking about the juvenile justice reform.
Thanks, Lindsay. Good morning, everybody. Glad to be here. Ricky just kind of, I think everybody has at least a basic understanding of the Juvenile Justice Reform Diversion Grants, but wanted to kind of give everybody an update. So we are at this point officially 2 years in, but about 18 months, 19 months of having clients and doing all of that stuff. So just wanted to kind of give a brief overview and update as to what's going on. So Amy, if you can go to the next slide. For those of you who may not be aware, when the Juvenile Justice Reform Act of 2018 was passed under Governor Haslam, $4.5 million were set aside to increase services to juvenile justice involved youth. And our department was tasked with disseminating those funds and overseeing that work. So on the next couple of slides, and I know everybody has this, and I won't read it to you, but it's just kind of the language that we put together as a department to kind of keep track of what's going on. It's in our contract. So you'll see, you know, the primary purpose, like I said, is to expand those services. We are, I always try to jump ahead of myself, so hold on, I'm going to stop. Amy, if you'll go to the next slide. So the goals are basically to divert those youth. We are, as I kind of like to say, we're SOCAT light, where the system of care kind of sees those kids that it's kind of that last stop. We try to serve the youth that have that first touch with juvenile court, the lower level offenses, your status offenses like your truancy, unruly behavior, that kind of thing. And I will say, I tend to talk a little fast. I'm going to try to slow down, but if anybody has any questions, we'll get to those when I'm done. But we try to get those at that initial stop into juvenile court. We have some programs that are actually working with schools before those charges are even filed to really truly be a diversion program. So the programs the majority of the referrals come from juvenile court. They also come from the Department of Children's Services, and then again, also schools at this point. Work with the programs. These are community-based in-home programs. So all of our providers go to the youth and families and provide those services in the home and in the community. Amy, go ahead to the next slide. And so here's where you just see a little bit more kind of what I talked, those youth that are at risk of further charges in the juvenile system, at risk of being brought into state custody. Those are the youth that we're really targeting with these dollars and these programs. And then on the next slide, you'll see our outcomes for these programs. We want to reduce that out-of-home placement. So our goal at the end of our time with these youth is to ensure that they are staying at home in their community. Obviously, we want to save money. It's always a good thing. We like to see that we're being good stewards of these funds. Improved quality of life outcome. Each provider, and you'll see, we won't really go into depth on those, but each provider has their own, you know, they're serving youth that are at risk. They're serving them in the home, but they are, they all kind of have their own evidence-based practices that they're using, their own way of tracking those outcomes. So that's another one. And then reduction in recidivism, which is, of course, those further charges. Excuse me. Okay, Amy, next slide. Okay, and then here you'll see that we are a statewide. When these money, buddy, you have to wait. I'm sorry. We're also having school at my house. We are a statewide program. When these funds were introduced, we really wanted to focus on increasing those services outside of kind of, you know, our big four counties, and make sure that we reach all of the rural areas. So we are covering 90 counties as of right now, and you'll see we have 6 providers across the state. Okay, next slide. And then you'll see, so these next several slides are our providers, the assessment tools that they use to assess those improved life outcomes, and then the evidence-based interventions that they use. There are some programs that kind of are across the board. They use some different things. The JJ CANS is one of the assessment tools that's used more often. Peer counseling is that little pocket up there Benton and Henry. Amy, if you'll go ahead and go through the slides. So you got Frontier Health in Region 1, Helen Ross McNabb, Tennessee Voices for Children, Volunteer Behavioral Health Care, and Youth Villages is our last one. And they cover a good portion of Region 5 and Region 6. And then, yep, there we go. And then, so like I said, we have been taking clients since January of 2019, or actually, I said 2018, but I'll tell you that was a typo on my part. That should say 2019. Gotten over 1,700 referrals, over 1,200 admissions, and 847 discharges. Of the clients that have been discharged, we are at about an 85% success rate right now, and hoping to improve that as time goes on. Also, one other thing, and I failed to put this into my PowerPoint, when the Juvenile Justice Reform Act was passed and those funds were set aside to increase these services, Governor Haslam also created the Juvenile Justice Reform Implementation Council, of which he also appointed he appointed about 20 folks from across the state in different jobs and whatnot. There's some state people, there's some attorneys, people from the Administrative Office of the Courts, judges, a state representative, senator. So it's a wide range of expertise. And before kind of, everything kind of came to a screeching halt, some of the things that Implementation Council are looking at are ways to improve data collection across the state when it comes to these youth. There's just a lot of, because every county has their own juvenile court jurisdiction. Things look a little different across the state. So that's one of the things that they're looking at. And then assessments through juvenile court is another one. So it's a good working group, and hopefully here in the future I can come back and report out onto how that council is doing and the work that they're doing. But I just wanted to let you all know that that's up and working. And I know that was a very quick overview, and would love to, if there are any questions, available.
Does anybody have any questions for Elizabeth? You can always type it in the chat as well if that's more comfortable for you. I can read them off.
Oh, you know what, Megan, thank you for saying that. That is, and that I forgot to say that insurance should not be is not a barrier to these programs. So thanks for actually saying that, Megan, and reminding me that that's something that I usually, you do, for our programs, you don't even have to have a mental health diagnosis or insurance. It's that touch with juvenile court is how you become eligible for these programs. And Amy, I think the PowerPoint was in the invitation, but if you don't have it, I'm sure we can get it to you.
Yeah, Kirby emailed both of the PowerPoints out with the agenda, but if someone is missing off of that, yeah, we can definitely send them back out again. All right. Do we want to get the next presentation pulled up? I think, Amy, are you working on that?
Yes, I'm pulling it up right now.
Perfect.
Okay, it should be on the screen now.
I see it. All right, Helen and group, if y'all want to get started.
Okay. Hi. Yeah. So I am Helen Rogers. I am with the Department of Children's Services, and we are I'm here today with Rebecca Bevins and Michelle Ryder. And together, we're 3 of the core team members for the Family First Prevention Services Act implementation team. So I think we can go to the next slide, please. So most of you all are probably familiar with Family First, but we're just going to do a quick, brief overview and then give you a little bit of an update on the activities we've been taking since early this year. So Family First is an act that has the potential to dramatically change child welfare systems across the country. We've been describing it as the most transformational child welfare act since the Adoption Safe Families Act in the mid-90s. Family First allows states the options to use to claim reimbursement for federal funds for prevention services that would allow candidates for foster care to stay with their parents or kin caregivers. The prevention services can also be provided not only to the children and youth, but also to the kin caregiver themselves or the parent themselves. We can be reimbursed for the prevention services for up to 12 months at a time. After that initial 12-month period, we would have to do a redetermination, but we can extend that. We can't extend those services for another 12 months if we determine that the child is still a candidate for foster care. If we're claiming reimbursement for a prevention service, that service must be evidence-based and it must be rated by the Title IV-E clearinghouse. We have seen that the Title IV-E clearinghouse in their ratings has been a little bit more restrictive than other evidence-based clearinghouses. So we can send out a link to that if people are interested, but it is using a little bit of a different ratings. Programs are coming out rated differently than they are in the California or other evidence-based clearinghouses. And then in the congregate care world, Family First pushes us to use foster homes as the first option for kids that enter custody, and then also seeks to raise the level of congregate care by limiting what placement states can claim reimbursement for, and creates a new class of programs called qualified residential treatment programs that Michelle's going to talk about. So I think we can go to the next slide. So our the department and the state of Tennessee's target implementation date for Family First is July 1, 2021. States have the option to delay that implementation date until October 1, 2021. So we're going about 3 months early. So far, we have contracted for technical assistance with Chapin Hall out of the University of Chicago. We meet with their core team every other Monday. For us, they are helping us determine who our candidate for foster care should be by looking at a couple of years worth of data and seeing what kids enter care, what the characteristics of those kids are, things of that nature. And then they're also helping us select the appropriate evidence-based programs to serve those kids that are candidates for foster care. We hope to have a good candidate definition and a better idea of what evidence-based programs we'll be including in a 5-year prevention plan in late August or early September of 2020. In order to claim reimbursement for the prevention services, we have to have an approved 5-year prevention plan. The prevention plan has to be approved by the Children's Bureau. We're targeting an initial submission of that plan in spring 2021. And then we have also implemented a congregate care pilot. So along with limiting the settings in which states can claim for federal reimbursement, the Family First also puts certain requirements on the state agency to complete an assessment to get the placement approved by a court if you're moving into a group care setting. So we have been piloting that with our staff, and we have continued to roll that out statewide. So I think we can go to the next slide, and Rebecca's going to take over.
Hey, everyone. So Helen and I co-lead the prevention component of Family First. Helen already talked a little bit about Chapin Hall, but they have been absolutely instrumental in moving this project along. They have nationwide experts who have helped multiple states and have helped multiple states get approved with their prevention plan through the Children's Bureau. So they've been providing us so much knowledge and support. Helen and I run a work group, which actually a couple of you guys are on, so it's good to see you. And that work group is compiled of community partners from across the state, some internal DCS folks at all levels. So we have some staff who actually work with families, and then some more program level directors. And this work group has been so helpful in just kind of steering the direction that we're going. The Children's Bureau is really hoping that this prevention plan is the vision for the state of Tennessee in terms of child welfare and where we want to take our child welfare system. So having all those different partners at the table has just been so beautiful in that collaboration of what is our shared vision. We have done a lot of work around creating our theory of change and what we want that to look like. And Carrie has been absolutely incredible in helping us engage our statewide providers around the use of evidence-based programs. We sent out a provider readiness assessment across Tennessee to get a good understanding of what is currently being offered. One of the current challenges is that the clearinghouse hasn't reviewed very many evidence-based programs. It's kind of a waiting game. They have over probably 200 programs currently in their queue waiting to be rated. But again, it's kind of a waiting game for us to figure out how are they going to rate things. Like Helen said, they do seem to be a little bit more rigid with their ratings. So some of the ratings I think have been a little bit surprising. We are really looking at the use of motivational interviewing within our own agency, as that seems to have been something that was heavily used in DC in their prevention plan. And then we also, Chapin Hall just helped us create a heat map based on the answers from the readiness assessment and also from the information that's been collected from SOCAT from providers. So we just sent that out to our prevention work group and just are trying to make sure that the data looks correct. But it's been really helpful to kind of see the clusters where there's a lot of evidence-based programs and then there's a couple counties where there doesn't appear to be anything. We're really going to try to use that data as we move forward in collaborating with our providers to try to build up more services in those areas. And that's something that we can send out to this group as well if you all would be interested in seeing that. Our Tennessee team, we participated in an evidence building academy by the Urban Institute, and that was really helpful in us kind of building our understanding of how these evaluations are completed for the evidence-based programs and if we ever want to move forward with doing our own internal reviews. One big change that we are going to be doing internally at DCS is updating our TFAC system to really build a comprehensive workflow that will support our case managers in selecting evidence-based programs for families. We're calling it our assessment integration, and essentially our FAST tool will automatically populate a non-custodial permanency plan for a family, which is essentially our version of a prevention plan. So it takes some of the guesswork out of it for our case managers, as well as reducing, the subjectiveness of who's getting an evidence-based program. So we're really looking forward to that enhancement supporting our staff. I think you can go to the next slide now. Okay. Michelle?
Yeah, I just had trouble getting myself unmuted. This is Michelle again, and I'm going to talk a little bit about the QRTP and the custodial side of Family First. It does provide, as Helen said earlier, for how we place children in custody and parameters around how we can receive federal funding reimbursement when we do place those kids. And specifically, we're focused on those congregate care or those residential settings outside of a foster home. The Family First Prevention Act puts a lot of requirements around specific placements that we can place in and the requirements that DCS has to meet in order to place in those placements. We're working with our providers now in our current setup to become, hopefully, when Family First does roll out, a QRTP, which is Qualified Residential Treatment Providers or programs. Those programs are going to have to meet certain requirements like 6-month aftercare, have trauma-informed programming, have on-site clinicians or access to clinicians and nursing 24/7. So just those are some of the changes that our providers are going to need to make if they want to become a QRTP. So when we roll out with Family First, in order to place in a QRTP, we are working on a pilot right now with our staff to meet the requirements of placing in the QRTPs. So hopefully that when we do roll out next year, in July 1, that our staff will be ready to meet those deadlines. And we started this back in the winter in January, and we have rolled out in 6 regions. We're trying to do 2 regions about every couple months, just to kind of keep a flow and do it in waves and not to overburden us with training. And then we provide feedback and technical assistance with the regions as they roll out. And so our goal is to hopefully have everybody at least have a few months of time to practice the requirements for the regions when placing children in these residential settings by the time we actually go live, and it starts affecting federal reimbursement. So we did initially, focus on those smaller congregate care settings. Now we're focusing on a much greater number of congregate care facilities. And as we've gone along, we realized that there's tweaking along the way. We've tweaked, I think, in each region that we've rolled out, and we're talking about maybe adjusting the pilot just a little bit to see in a couple regions to kind of see how 2 different ways works for us as a state. But our frontline staff are going to have to, like Helen said, do an assessment, which we're going to use the CANs within 30 days of the placement in a QRTP. They have to have a child and family team meeting or CFTM within the 30 days and use that CANs to guide the decision making for that placement. And then the CANs consultant is going to have to be in the meeting to help make that decision on whether or not this is an appropriate placement over a foster home for this child. Once that's done, then the requirement for through Family First for placing in a congregate care setting is then the court also has to review the placement within 60 days and give approval or not to the placement, or agreement or disagreement to the placement. So like I said, we've been working with our providers. We've talked to them, most of them one-on-one. Sorry, I just saw the chat pop up. So how will it work for foster care disruption? So this only affects the congregate care setting. So if a child is in a foster home, we don't have to do these processes. If they disrupt from a foster home because they do need a higher level of care and go into a congregate care setting, then they would have to, which is part of our protocol anyways, update their CANs because there's obviously been a change and a new need that we need to address. So we'd update the CANs, and we're supposed to have a CFTM when we're making a placement decision, or it's called a placement stability child and family team meeting. They would have that meeting using the CANs, and the team would determine whether or not, if they are leaving the foster home, if actually one of these congregate care settings is appropriate for them, or maybe just more services in a foster home. Does that answer that question? Maybe I'll see it. Okay, good. So we have been working with the providers, and like I said, we've engaged them. The team has engaged them one-on-one, had lots of conversations to help them talk through the issues that they're worried about as far as becoming a QRTP, what changes that might require for some of them. Some it's not going to be many because they have already the access to clinical and nursing staff. Some may have a little bit more work to do along the way. All of our providers anyways, we've contracted with, and they meet the requirements as far as accreditation and those kind of things already. So there are just some tweaks that some of them may have to make to their programming in order to move forward as QRTPs. And we did do the provider readiness assessment, and we followed up with some of them to help them kind of see where their next steps are in getting ready, and reassuring some of them that, you know, that they're not as far off the mark as they might think that they're afraid that they are. We are getting technical assistance from Chapin Hall so we can see where our needs for placement are and what levels of placement to help us determine how we move forward in contracting and the resources that we need for either QRTPs or foster homes in the future when we roll out in Family First. And that, I think, is my slide. That's the only slide I've got. Any other questions? Okay, thank you.
Yeah, so I think that's our presentation. I will say that we do a monthly newsletter as well to keep interested individuals updated on the progress that we're making. If anyone is interested in being put on that newsletter, I will drop our sort of dedicated email box into the chat. You can just send an email to that email box, and we'll add you to our distribution list.
Great. Thank you, everybody. Is there any other questions for either one of our presenters or group? Okay. Kirby, I'm noticing on here it has the 2021 meeting date, but not our last meeting date for 2020 on the agenda.
No, we just put, typically around this time every year, I work ahead just to get those 2021 dates on your calendars. It's always the first Wednesday in, let's see, February. Yeah, February, May, August, and November. So just to get those on your calendar, our next meeting will take place in November. Let me see the date here.
November the 4th.
Yep, November 4th, same time. Not sure yet if it will be virtual or, it's always a conference call. So I'm not sure if it'll be WebEx or conference call where we can meet in the office yet, but I would prepare for virtual.
Yeah. All right. I don't have anything else unless anybody else does.
And always, if you have any topics for future presentations or ideas, please email Lindsay or Ricky or myself, and I'll be happy to reach out to those individuals. And thank you to our DCS partners for presenting and for Elizabeth for presenting today. I know they're probably tired of my emails, so I appreciate you all presenting today.
Thank you.
All right. That's all I have, so we can adjourn.
Thank you, everybody.
Thank you.
Thanks, everybody.
Bye, everybody.
Bye-bye.
Have a great day.